Have you ever wondered just how deep the vagina really is? We often hear about average penis size in popular media. Statistics get thrown around, and people compare measurements as though that's the primary figure to pay attention to. But what about vaginal depth? In many ways, the vagina has remained mysterious, fueling myths and misconceptions about whether it's big enough or too small, and what influences its size in the first place. Today, we're going to explore the fascinating science behind vaginal dimensions, delve into what actually affects its depth and width, and discuss why this knowledge matters for healthy, enjoyable intimacy. Before we get into the details, here's an eye-opening statistic you might find surprising. According to multiple studies, including one published in the International Urogynecology Journal, the average vaginal length, when not aroused, is around 3.9 inches, or about 9.8 centimeters. That's significantly shorter than you might expect when you consider that the most cited average erect penis length is somewhere around 5.4 inches, as noted in large-scale research published in the British Journal of Urology International. How does that work out during intimacy? Well, that's where the remarkable flexibility of the vagina comes into play, because there's much more to the story than mere numbers. Let's dive right in. Why measurements vary. One key reason the vagina might seem smaller on paper is that the measurements we talk about often refer to its resting state. In other words, the 3.9-inch average length, roughly 9.8 centimeters, is typically measured when a woman is not sexually aroused. During sexual arousal, the vaginal canal can undergo a process known as tenting, where the cervix and uterus lift up, effectively lengthening and widening the vagina. This expansion can add 1 to 2 extra inches in length, making room for comfortable penetration, even when the partner's penis length exceeds the vagina's typical resting dimensions. Research backs this up. The same study from the International Urogynecology Journal that found the average at 3.9 inches also noted a wide range of normal vaginal lengths, anywhere from about 2 inches to nearly 5.7 inches, 5 to 14 centimeters. When you factor in arousal, those upper measurements can increase even more, underlining that there's no single correct size and that the body naturally adapts. Breaking down the numbers. Most studies on this topic are remarkably consistent about the average vaginal length hovering between 3.5 and 4 inches, 9 to 10 centimeters. One study published in the American Journal of Obstetrics and Gynecology analyzed more than 3,200 women in a pelvic floor clinic and landed on an almost identical average of 3.7 inches, around 9.4 centimeters. Another large study looking at sexually active women found the mean vaginal depth was about 3.6 inches. Again, right in that same ballpark. Interestingly, these measurements don't just stop at length. Some research also explores how the vagina's width changes from the opening to near the cervix. The outer portion tends to be narrower, often around 0.6 inches, 17 millimeters, while further in, it can widen up to 1.8 inches, 45 millimeters, and in some cases, even more when aroused. This shape can be described like a tube that's slightly tapered near the entrance, but broader deeper inside. Why is this shape important? Think of it this way. The vagina is designed to be flexible. It doesn't just passively sit there. It responds dynamically to touch, movement, and sexual excitement. During arousal, blood flow increases to the pelvic region, lubrication ramps up, and the vaginal walls become more elastic. All these physical changes help make intimacy more comfortable and pleasurable for both partners. What influences vaginal size? You may have come across the idea that having more sexual partners or frequent intercourse permanently stretches out the vagina. Fortunately, that's a myth. The vagina is made of muscle-like tissues, collagen and elastin, that allow it to expand and return to a resting state. Just like other muscles in the body, it can tighten or loosen a bit, depending on factors such as pelvic floor strength, hormones, and overall health, but not simply due to frequent sex. Let's take a closer look at factors that have been scientifically shown to affect vaginal length and elasticity. Number 1, age. Aging can lead to slight changes in vaginal length. According to research, this change is minimal, often calculated at around 0.08 centimeters per decade. Over a lifetime, the total difference might be less than half an inch. Number 2, height and weight. Taller and heavier women sometimes have marginally longer vaginas, with one study noting that a 10 centimeters increase in height could correlate with roughly 0.9 centimeters of added vaginal length. But these are very subtle differences, hardly enough to be a defining factor of whether someone's vagina is long or short. Number 3, menopause. After menopause, lower estrogen levels can affect the elasticity and lubrication of the vagina. Studies note a slight decrease in vaginal length, around 0.17 centimeters, after menopause. However, dryness is usually a more common concern than minor length changes. Vaginal estrogen creams, lubricants, or other hormone therapies can help maintain comfort and tissue health. Number 4, surgeries and medical conditions. A hysterectomy, removal of the uterus, can lead to a decrease in vaginal length. Some research places that number around 0.63 centimeters, or about a quarter inch. Other pelvic surgeries can have a smaller impact too, about 0.22 centimeters. Yet even these changes are typically small and may not noticeably affect sexual function, especially with proper postoperative care and pelvic floor physical therapy when needed. Does frequent sex make the vagina loose? There's a persistent rumor that having sex, particularly with multiple partners, can permanently enlarge or stretch out the vagina. This simply isn't true. The muscles and tissues of the vaginal canal are designed to expand and then retract. Even childbirth, which obviously involves a far larger expansion than any penis, does not result in a permanently stretched vagina for most women. While it's true that some new mothers experience loosening right after delivery, they often regain much of their pre-pregnancy muscle tone through natural healing and pelvic floor exercises over time. If you're concerned about tightness or looseness, your pelvic floor muscles are the real focus. These muscles can become weaker due to pregnancy, aging, hormonal changes, or even certain health conditions. Pelvic floor physical therapy, or regular Kegel exercises, where you consciously contract and relax the pelvic floor, can help restore strength and tone. The role of arousal and tenting. The term tenting refers to the phenomenon where the upper part of the vagina widens and lengthens significantly during sexual arousal. The uterus and cervix actually lift away from the vaginal canal, creating more space. This change doesn't happen instantly. It requires adequate foreplay and a state of true arousal. That's one reason rushed intimacy can sometimes lead to discomfort. If the body isn't yet ready, the vagina remains closer to its resting dimensions, which might be a tighter fit. This is also why lubrication is a big factor in comfortable penetration. When the vagina is properly lubricated and relaxed, it stretches with ease to accommodate an erect penis, even one that measures on the higher side of the average range. If you or your partner worries about the depth mismatch, focusing on extended foreplay, adequate arousal, and open communication about comfort levels can make a significant difference in the overall experience. Why knowing the facts matters. Understanding the science behind vaginal depth isn't just about satisfying curiosity. It's also about promoting healthy and enjoyable intimacy. Many women feel pressure or shame due to misconceptions like, "My vagina isn't deep enough," or "I must be abnormally small or large." In reality, as you've seen, there's a wide range of normal variation. The body is incredibly adaptable. For men, having a clearer idea about vaginal size can alleviate performance anxiety tied to penis length. When you learn that the vagina expands significantly upon arousal, it becomes clear that a couple can enjoy satisfying intimacy without constantly worrying about exact measurements. Sure, there might be outliers. Some men have penises longer than average, and some women have shorter than average vaginas. But even then, open communication, exploring different positions, and allowing for ample arousal time can often ease any challenges, addressing laxity and pelvic floor health. So what about those who do feel that things are a bit looser than they'd like? Some individuals experience laxity in the vaginal tissues for various reasons, childbirth and age being among the most common. However, pelvic floor exercises, often known as Kegels, can be a game changer. By contracting and holding the same muscles you'd use to stop urine flow, you help tone the tissues that support the vagina. Regular, consistent practice can lead to noticeable improvements in sensation, control, and even sexual satisfaction. If exercises alone aren't yielding results, consulting a pelvic floor physical therapist could be the next step. They specialize in diagnosing and treating issues related to these critical but often overlooked muscles. Sometimes, underlying conditions, like nerve injuries or connective tissue disorders, might be at play. Diagnosing them can open the door to more targeted treatments. The myths versus the realities. To sum it up in practical terms, myth: the vagina is far smaller than the penis, leading to incompatibility. Reality: while the resting length of the vagina is typically around 3.5 to 4 inches, it can extend by up to 2 extra inches during arousal, comfortably accommodating the average erect penis. Myth: frequent intercourse or multiple partners will stretch the vagina permanently. Reality: the vagina is designed to expand and contract. It naturally returns to a resting state after intercourse. Pelvic floor exercises can maintain or restore muscle tone if needed. Myth: aging causes drastic changes in vaginal size that make intimacy uncomfortable. Reality: while menopause and age-related hormone shifts can lead to changes in lubrication and slight decreases in elasticity, solutions like topical estrogen and lubricants can significantly improve comfort. Myth: the only solution for looseness is surgical repair. Reality: surgery is rarely the first step. Pelvic floor therapy and Kegels are effective, non-invasive ways to enhance muscle tone and address laxity. Why compatibility is about more than measurements. The human body is wonderfully adaptable, and sexual compatibility is rarely dictated by inches alone. Emotional connection, mutual respect, understanding, and open communication about preferences and comfort levels go a long way in ensuring fulfilling sexual experiences. Taking the time to understand your own body, or your partner's, opens up opportunities for better intimacy, fewer misunderstandings, and a healthier view of sexuality overall. If you still have concerns about vaginal dimensions, you can speak to a healthcare provider for personalized assessments. In many cases, women who worry about being too tight or too loose are well within the range of normal. But if there's persistent discomfort or pain, that's worth addressing. Conditions like vaginismus, involuntary tightness of the vaginal muscles, or other pelvic floor disorders can make intercourse challenging. A physician or a specialized therapist can help diagnose and treat these issues. Practical tips for maximizing comfort. Take your time. Foreplay isn't just a fun add-on. It's essential for allowing the vagina to expand and lubricate. Use lubricants, particularly for women who are postmenopausal or experience dryness. A water-based or silicone-based lubricant can enhance comfort. Try different positions. Some sexual positions allow for deeper penetration, while others create a more shallow angle. Experiment to find what feels best. Practice pelvic floor exercises. Kegel exercises help strengthen the muscles around the vagina, improving both tightness and sensation. Communicate. Don't be shy about voicing your comfort level. Open communication helps avoid rushing and leads to a more pleasurable experience for both partners. Final takeaway and a note on body confidence. At the end of the day, it's crucial to remember that human bodies are diverse and adaptable. No one's anatomy is exactly the same as anyone else's. If you're worried about being too small or too big, you're far from alone. But as scientific evidence and everyday experience both confirm, the natural processes of lubrication, engorgement, and muscle expansion typically bridge whatever gap might exist between the measured average vaginal depth and average penis size. In most cases, the body already has what it needs to experience satisfying intimacy. Still, certain factors, like hormonal changes, medical surgeries, or aging, can require a bit more attention. Pelvic floor exercises, lubricants, hormone therapies, or even talking to a mental health professional about body image concerns can make a world of difference. Sexual health is an integral part of overall well-being, and feeling at ease with your body is a key component of that. So the next time you hear someone fretting over how much size matters, remember the facts. The vagina is typically around 3.5 to 4 inches at rest, but can expand significantly. With adequate time and arousal, the human body is ingeniously equipped to fit together in ways that bring mutual pleasure and closeness. If you feel like you need more tips on maximizing pleasure or addressing concerns related to intimacy, there are many resources available. As a starting point, you can check out a free ebook, like the one mentioned in the original version of this discussion, that offers guidance on sexual wellness and techniques to enhance pleasure. While an ebook might not replace professional healthcare advice, it can provide insights and practical tips you can explore further. Remember, your body is worth taking care of, and knowledge is power when it comes to demystifying topics like vaginal depth and dimension. Before we wrap up, here's something I'd love for you to do. If you haven't subscribed to our channel yet, I'd love for you to hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support means the world to us. If you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. So, what do you think? Is the vagina deeper or shallower than you expected? Have you encountered any misconceptions about vaginal size among your friends or in popular media? I'd love to hear your insights in the comments. Your experiences and questions fuel these conversations and help us all learn more about healthy sexuality. Remember, you deserve to feel confident and informed about your body. It's your health, your pleasure, and your power. Take care of yourself. You're worth it.